Hello everyone, welcome back to our channel, and for today's video we are going to discuss another important concept about your community health nursing, which is your HIV STI prevention program. In 2018, there are reported confirmed HIV confirmed cases of 31 per day, and that is an average of 1,000 cases per month in the Philippines. This number is steadily increasing and it's now very alarming. That is why HIV infection is now considered as a silent epidemic. Epidemic because it's starting to spread in terms of number, and silent because a lot of people are not aware of the danger that is brought about this spreading infection in the community. That is why STI and HIV prevention program was created by the Department of Health to address this concern. Now, the goal or the overall goal of your HIV prevention program is to reverse the trend of HIV epidemic by reducing the estimated annual infection to less than 7,000 cases by 2022. That is correct because we are actually confirming more than that, okay, before the year 2022. And still, as of the moment, the number are steadily increasing. That is why we are trying to reverse the effect of this epidemic by doing these programs. Now, let us describe briefly this program. This program is created to reduce the transmission of HIV and STI or sexually transmitted infection among the most at-risk population and the general population, and also to mitigate its impact at the individual, family, and community level. Basically, this program not only aims to prevent the spread of this infection but also to manage those people who have already the condition. This is basically to address Millennium Developmental Goal number 6, okay, which is to combat HIV, AIDS, and also your other communicable diseases. Now, in the new developmental goal or SDG number 3, this is still included in one of the indicator of sustainable developmental goal number 3, which is specific for health. What is the legal basis of this program in the implementation of this in the Philippines? So this is based on Republic Act 11166, for you not to forget it. Just remember the 26 in the last part of the numbers. It sounds 6. So you do not forget that, because this is basically to prevent the spread of sexually transmitted infection, specifically your HIV/AIDS. That is why this law is also known as your Philippine HIV and AIDS Policy Act. Now, because of this law, the Philippine National AIDS Council or PNAC was created to create now the guidelines that we are going to follow in the implementation of this program in the Philippines. Now, what is the vision and mission of this program? The vision is basically to do three things. Number one, to achieve zero infections or zero new infections. We are trying our very best, especially the Department of Health, to spread awareness about this HIV so that there are no new cases to be registered. Okay, and also for those already affected by this condition, as we already know, stigma about this case or condition is very rampant in our community. That's why we also want to prevent any type of discrimination among people who are already positive with the condition. And also, this is one of the reason why a lot of people who had possibly have the condition is very afraid to go for testing because they're very afraid of discrimination if they were known to be positive. And of course, the last thing is to prevent any AIDS related death. And as we already know, if you're done studying your HIV infection, the most common cause of death are the complications such as your pneumonia, which is caused by your pneumocystis carinii infection. The mission of this program is to improve access and utilization of preventing primary healthcare services for HIV and STI. Maybe a lot of you are not aware, but these programs are actually given at the primary healthcare in the community free of charge or at zero cost. This is to encourage a lot of people who have engaged into a not safe sex, okay, to know their status about sexually transmitted infection, specifically your HIV infection. And these are all given up free of charge, part of the program, and also the government would also cover the treatment and medications that you will be needing in order to manage the case if it turned out that you are positive with the condition. Now, what are the programs and activities included under this program? Number one is the availability of free voluntary HIV counseling and testing services. Just like I've mentioned earlier, okay, it's gonna be given free of charge. You don't need to pay anything. All you have to do is to go to the nearest facility that conducts HIV testing for you to know your status. And it's gonna be free of charge, and follow-up services will be given depending on the case or depending on the result of your testing. It is also encouraged to have a 100% condom use program, especially under the entertainment establishment. So entertainment establishment, we are not referring to the actors and actresses. We are referring actually to those who are working in the nightclubs, okay, or institutions alike, okay, that is offering sexual acts or sexual pleasures to their customers. Okay, the use of condom is the most effective way to prevent in terms of the family planning method, but of course, in terms of the most or the most effective, okay, the most effective way is your abstinence, okay, on top of your condom. So if we are going to talk about family planning method, of course, the best way is the condom use because abstinence is not a form of family planning method. But if we talk about the most effective way, it is still abstinence because if you will not have sex, you will not have the condition. Another one is the peer education and outreach. That is why a lot of community people, especially the young ones, are actually creating programs that aims to increase the awareness, especially among the young individuals in our community. That's why a lot of programs, especially in the SK and even in the schools, they actually focuses on this type of programs, awareness or spreading awareness about the condition. Another one is the multi-sectoral coordination through Philippine National AIDS Council, which is basically referring the patient into inter and intersectoral linkages that would help them, okay, with the testing and even after they were confirmed positive with the condition. Another one is the empowerment of the communities. Empowerment of the communities, meaning we want to develop the community's capability to handle the situation in relation to the primary goal of community health nursing, which is enhancing the capability of the people. We also have your community assemblies, and for us to reduce the stigma, because if the people are aware about the HIV and how this HIV is being transmitted, the stigma of us talking to the people or who have confirmed cases will be lessened, especially if we know how to transmit and also to prevent the spread of this infection. Okay, and the augmentation of resources of social hygiene clinics, and the last one is the procurement of male condoms distributed as educational materials during outreach programs, not only to the community but also to other establishments including companies and even school populace. Okay, and these are the 8 program activities under the HIV STI prevention program. Now, what if the patient turned out to be positive of HIV? So, what are the help that the government can actually provide to this type of patient? So, if they are a member of PhilHealth, okay, or Philippine Health Insurance Company, which is tied up with the government, or the health insurance company that is being handled by the government, okay, under the PhilHealth Circular 011-2015 and 2018-0004, outpatient HIV/AIDS treatment, or also known as your OHAT package, will be given to this type of patient, meaning they can get a benefit from their PhilHealth insurance and will get the free testing plus the medications necessary to manage HIV infection. Take note, HIV infection nowadays is already manageable, meaning for as long as you follow the guidelines and protocols and you're taking the medications, specifically the antiretroviral drugs to decrease your viral load, patient who is confirmed HIV infection can still live a normal life. Okay, that is one thing that we need to emphasize if you know someone who has a positive HIV. So another benefits of this program is it provides trainings, okay? Trainings to whom? Number one is HIV counseling and testing training, especially to health workers in the community level or the primary health care that is designed for healthcare providers and lay people providing HIV services to enhance knowledge, skills, attitudes, and providing HIV counseling, including the pre and post test counseling to the clients who access the service at the health facilities. This is organized by the Centers of Health Development of the Department of Health. Take note that even those organizations or the non-government organization focusing on HIV prevention would also can also avail of these programs or HIV training, counseling, and testing training provided by the government. Okay. Another one is the primary HIV care training for health services provider, which is designed for facilities that intend to become an HIV treatment facility. This organized by the Centers for Development, also by the Department of Health. Okay, again, this includes now any primary healthcare facility, including those who are under the level 1 of primary healthcare facility like health centers, private clinics, and the likes. Now, who should get tested? Okay, who are the people should get tested with this condition? CDC recommends that everyone between the ages of 13 to 64 who is or who are sexually active should get tested for HIV at least once as part of their routine health care. Okay, we do more often to those who belong or okay, some sexually active gay and bisexual men they also may benefit from this frequent testing, example 3 to 6 months, because they are the population that is most at risk according to the statistics, because a lot of the confirmed cases are under this population group. And of course, part of the pregnancy package is also for pregnant women. They have to be tested with this infection as well. This is also to provide them the proper treatment, and of course, to provide a prophylactic management for their growing fetus. Another one is that if you are actually trying to ask yourself if you are someone to get be tested, okay, these are the questions that you need to ask. So are you a man who has had sex with another man? Or have you had sex anal or vaginal with a partner who has HIV? Have you had more than one sex partner since your last HIV test? And have you injected drugs and shared needles, syringes, or other injection drug equipment, for example, cookers with others? Okay, these are the questions that you might need to ask. Okay, if someone asks you, or if you're asking yourself if you need to be tested with the HIV kit. Another one is have you exchanged sex for drugs or money? Okay, like those who are working as entertainers and did not use any condom during the act. Have you been diagnosed with or treated for another sexually transmitted infection? Because high likely if you have STI, probably the chances of you getting HIV infection is also high. And have been tested or diagnosed with or treated for hepatitis or tuberculosis? If you're actually confirmed tuberculosis patient, it is required by the law that you need to be tested for HIV as well. Same thing is true that if you are tested with HIV, you have to be tested for tuberculosis. And the last one is that have you had sex with someone who could answer yes to any of the above questions or someone whose sexual history you don't know? So these are the questions that you need to ask in order for you to confirm if you need or if this is necessity for you to undergo any HIV testing. So that would be all for our discussion of the HIV infections. If you do have any questions, just feel free to ask and comment it down sa ating comment section. You can also like and share these videos if you have learned from it. And thank you for watching. Please don't forget to subscribe. See you in my next video. Bye for now.